Doctors suggest a new weight loss injection drug for children ages 12 and up. It helps kids slim down, they say, by 16%, which much of America could get help from as well. For example, diabetes. Well, just look at the increase in type 1 diabetes in kids from 2001 to 2017. Among young adults, teenagers, America's future, the number of kids with diabetes doubled in less than 20 years. Ultimately, the cost of medical care tied to obesity in this country is $289 billion a year, and that number keeps going up. Dr. Corey Hebert is here, pediatrician, chief medical officer at Dillard University. Good to see you, Doc. We appreciate it. Big picture, why now are so many kids so fat?
You know, it is multifactorial. And you mentioned it earlier in the intro. Either you're going to pay me now or you're going to pay me later, right? So the reality is that the sedentary lifestyle that we have adopted in America, you know, where we sit around and we are not moving, we are on screens all day, we're eating very high sugar foods, we are just not doing the things that we used to do, is totally leading to this big epidemic. I will tell you, I've been practicing medicine for 25 years. And when I started, I didn't have one pediatric patient that had type 2 diabetes. Now I have over 40. This is something that is an epidemic. And when we have other epidemics, we have to address them with everything we have in our arsenal. And that's what this is doing. I mean, I'm not a big fan of giving children medicine for anything. I don't like to give medicine at all. I give medicine when it's necessary. And right now we are in an epidemic and we need to do something.
You talk about making hard choices when it's necessary. I get that. But you talked about sedentary lifestyle. You talked about high sugar foods. You talked about video games and what kids are spending their time doing. We'll take those one by one. Sure. And this unquestionably affects lower income Black and brown communities disproportionately, correct?
That is correct.
So I'm thinking about high sugar, high caloric foods. Why not take sodas and junk food out of EBT and food stamps as approved foods and purchases?
Sure.
Why not change the way we talk about diet and exercise and about body positivity before, or at least in conjunction with, these drugs?
Now that's a really good point. And people pose that to me all the time, but I'm going to put it to you so that you can really, really grab it, right? So it costs a lot of money to have organic broccoli, but it's very cheap to go to a bodega and get Vienna sausage and frozen potatoes and French fries and just fry them. It's literally quadruple the amount. So as a parent, you have to make that hard decision. And, you know, no matter if you live in the projects or if you live on Fifth Avenue, nobody wants bad things for their kids. They might want bad things for themselves, but they don't want bad things for their kids. But sometimes they just don't.
I agree with you. Look, I agree with you, and it's a lot cheaper to go buy instant mashed potatoes at the dollar store,
Sure,
if we want to talk about rural America, than it is to go buy real potatoes and butter and milk and make your own mashed potatoes. But that didn't quite answer.
The potatoes are the problem. All the potatoes are the problem.
Right, but
all the potatoes are the problem.
No, I hear you, but still, that doesn't answer the question about why you can still buy Frosted Flakes and regular Coke with food stamps. If the federal government's going to really get involved here, why is it just on the end of paying for all of these drugs, not on the side of limiting what we are going to pay for that's causing the problem?
Well, you know, and as a physician, I'll tell you, I'm kind of on your side in that way, because when America, what we do is spend $1 billion on a state-of-the-art orthopedic surgery facility at the bottom of a cliff, as opposed to building a $10 fence so people don't fall off the cliff and break their legs. Sometimes at the medical establishment, the money is in the actual treatment, not the cure. So what the federal government should do is to remove all those things from EBT cards. I totally agree. As a matter of fact, in the city of New Orleans, you know, in Louisiana, we have a huge obesity problem, but we have a law on the books that is about to be ratified very soon that says with a Happy Meal, you can't get a Coke. You can't. And I think that's the first step in making this a real deal, because people have to make hard choices. Why don't we take some of those choices away? Let's say now you have water or you have a healthy drink, and that's how we need to move forward. I mean, everything needs to be put on the table for our arsenal for us to be able to make this happen.
Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.